In our health alert tonight, Kelly Stafford, the wife of Lions quarterback Matthew Stafford, now back home following brain surgery to remove a tumor.
That surgery was expected to last 6 hours. Instead, it took 12 after doctors found an abnormal vein. Our chief health editor, Dr. Nandi, joins us now with more on the complications doctors encountered during this surgery. Doc?
So, Alan, acoustic neuromas are very rare. It's a non-cancerous tumor that typically grows slowly on the cranial nerve, which connects the ear to the brain. Now, as it develops and gets larger, it presses against the hearing and balance nerves, so you end up with symptoms like vertigo and dizziness, unsteadiness, and loss of balance, all of which Kelly said she experienced. You can also have hearing loss and tinnitus, which is ringing in the ears. In very rare cases, acoustic neuromas can be life-threatening if it gets large enough and actually compresses a vital area in our body, which is the brainstem.
And to think it doubled her surgery time, Dr. Nandi. We were looking at her posts, and she said she needed to find the new normal. So what can be expected from her recovery?
So, Glenda, there are several surgical treatment options, and the issues she could have really depend on which surgical option was chosen. The goal, however, is to avoid facial paralysis and preserve as much hearing as possible. But a patient really can end up with permanent and complete hearing loss on the side that have the tumor. They can also have headaches that may persist for months, sometimes even years. Other effects include difficulty blinking, double vision, eye sensitivity, dry mouth, taste disturbances, plus the balance nerve can take time to heal. But here's the thing, most people can get back to work in about 8 to 12 weeks.
Yeah, so that's some good news for sure. So, Doc, how does this type of tumor actually start, and can it return?
Alan, the cause is not exactly understood, but it's linked to a malfunctioning gene that's supposed to control the growth of cells that cover the nerves. About 5% of cases are due to a genetic disorder called neurofibromatosis 2, which affects both ears. As to whether the tumor can grow back, it is possible, but the good news is this typically happens to a small percentage of patients. We'll keep an eye on Kelly's recovery and see how she does.
We wish her a speedy recovery. Dr. Nandi, thank you for some insight there.
Absolutely.
If you have a question or health concern for the good doctor, email him at drnandi@askdrnandi.com and send it to us on Facebook or Twitter, and we'll get it right to him.